Hey, Dr. Richard Sands here. Welcome to your first assignment, which is analyzing quality improvement frameworks in healthcare. And this is part one of three parts. And this is part one, quality improvement framework. So this is a really fun assignment. So let's just take a minute and walk through it together. All right. So let's see here and scroll up. Summary: quality improvement is the framework used to systematically improve care. Quality improvement seeks to standardize processes and structure to reduce variation, achieve predictable results, and improve outcomes for patients, healthcare systems, and organizations. The quality improvement framework is developed to influence and guide thinking, planning, and healthcare delivery. It stresses strengthening quality, safety, and improvement in patient experiences, care across all healthcare services. Um, Quality improvement framework is important because it puts in place long-term processes to improve quality. For this assignment, you will compare quality improvement frameworks, apply a framework to a case study, and communicate your recommendations to key stakeholders. All right, so what does that mean? So I mean, there's a number of quality improvement frameworks out there that we'll touch on here down there at the bottom: Six Sigma, Lean, PDSA. So here in your tile, part one, quality improvement framework, paper that summarizes and compares the following for QI frameworks: description of each framework, including key steps, data used, and purpose; challenges of implementing framework; discussion of how each framework is used in healthcare. So, it's important key aspects here just in these three bullets you need to be aware of. Description of each framework. Okay, so basically describing it, including key steps, how long is this framework, how many steps; data used, that's important because if you don't have access to the data when using a certain framework, then your chances of success are limited. Like, for example, Six Sigma DMAIC is you have to have a lot of data. As you know, for my bio, I'm a certified Lean Six Sigma black belt, have run many a project with DMAIC, and you have to have access to data. Challenges of implementing the framework. In my dissertation thesis, and just being a Six Sigma practitioner, one of the things in my dissertation, I looked to prove through quantitative analysis on Six Sigma doesn't fail because of Six Sigma. And what that means is a lot of times where a Six Sigma DMAIC project was chosen to implement, it was not appropriately supported by leadership, resources, and data. So that framework is very intense. It takes a lot to do a DMAIC project, and when done correctly, the results are great. But if you don't have leadership support, if you don't have the proper resources, if you don't have the data needed, then your Six Sigma project is going to fail. And it's not because of DMAIC, it's because this framework was chosen. It's not a one size fits all. So the DMAIC framework would be chosen to use when it's not the right framework because you don't have the resources, you don't have the data, and etc. So you have to choose something different that best fits with your company structure, data, things of that nature. As you know, just from the previous screen, looking at when you look at week 3, for example, let's scroll down a minute. Boy, slow internet today. Okay, so the 5 whys problem solving model. Make sure you do watch this video because it's like it's a component of a bigger framework. But the 5 whys is my favorite because you can use it in anything, and it really all you have to do is ask why 5 times and strategically drill down to get to what the root cause is. Now, if you're watching, but actually both those videos about 5 why is, the 5 is not an absolute. It could be 4 or maybe it's 6, but just over a period of time, just asking why, tracing it back to the root cause, it's on about average of 5. So make sure you do watch these videos. They're very good, especially this one. You go back. Okay, let's move on. Okay, 1 second. All right. So this is part 1, instructions. Be aware of the various quality improvement frameworks and how they can be applied in various professional settings is an important skill set for managers. That's exactly what I just talked a minute ago, knowing what resources you have, what each framework takes. And as a leader, a manager, you're going to be the one to make the decision to say, this is the framework we're going to use, and here's why. Here's how we're going to support it. An organization makes specific decisions about what it wants to improve. Quality improvement frameworks are tools that can help quality improvement teams ask fundamental questions to identify the problem and potential solutions. Okay, number 1. Compare and contrast the following 3 quality improvement frameworks. Six Sigma DMAIC. Now, this is Six Sigma DMAIC. Six Sigma is first, Sigma is standard deviation, right? And so 6 standard deviations is near perfection. That's where the 6 and Sigma. Now, Six Sigma is an overarching term for a lot of tools in your tool chest, like the 5 why analysis. That'll fall under like Six Sigma or fall under Lean. DMAIC is a specific defect reduction model that falls under Six Sigma. Okay. And then Lean, and again, lean manufacturing, lean production. Those are all lean. It is lean, and the lean production, lean manufacturing, lean enterprise. Those are all spin-offs of basically lean. You'll also hear the term a lot of times, Lean Six Sigma, and what that means is it's taking the key aspects of lean, where you want to reduce waste. Six Sigma's defect reduction. So kind of over time, it has kind of evolved to Lean Six Sigma. But back to here. So Six Sigma DMAIC, that's one framework. Lean, and under Lean, there's a number of models too under Lean. Kaizen, 5Y, things of that nature. And then Plan, Do, Study, Act. Those are 3 distinctive different models. By addressing the following for each, briefly describe the purpose of the quality improvement framework. So what is the purpose? Briefly describe the purpose of the quality improvement framework. So what is the purpose? What do you use DMAIC for? What do you use Lean for? Okay. List and briefly describe the key steps in the process. So list. To any of these framework, there's very specific steps you have to follow. You have to complete this and complete that because it builds off each other. So what are those key steps? And describe and briefly describe the key steps in the process. You're going to list it, 1, 2, 3, and then describe what it is. Okay. For each framework, give at least 2 examples of the type of data collected that will inform the process, how improvement teams use the data. So like I said, a lot of these frameworks are data driven. So what kind of data do you need? And then discuss at least 2 challenges in implementing the framework. Well, as I explained briefly about DMAIC, it's a very complex, thorough, it takes time. A DMAIC project isn't done in, a day or 2 weeks. A DMAIC project is usually like, now this is not an absolute, but DMAIC projects could take a year. They could take 7 months. They could take 6 months, 5 months, because they're so intense. And you usually only apply them or use them on a big problem, a big issue, typically. Okay. So that's just for an example. Okay, now number 2 down there. Write a summary of your comparison, focusing on how each of the frameworks could be applied to improve quality in healthcare. Address the following for each framework. Okay, so part 1 is you're looking at the frameworks, you're writing out the steps, what's needed, what data. So you're kind of setting like just the facts, right? Okay. Number 2, again, write a summary of your comparison. So again, number 1 is you're going to compare and contrast. That means comparing. You're going to compare the two, right? So that's all about number 1. Number 2, now you're going to write a summary of your comprehensive comparison, focusing on how each of the frameworks could be applied to improve quality in healthcare. Address the following for each framework. Let me say that again. Write a summary of your comparison, focusing on how each of the frameworks could be applied to improve quality in healthcare. Now remember, healthcare is healthcare is very broad, right? So healthcare is, healthcare insurance companies. Like I used to work for United Health Group and Pacific Care. And so how do they process claims? Customer service, things of that nature, right? Billing, okay? You think about, I used to work for Kaiser Permanente, and now I work for Providence. So that's it's a provider, right? Where they're providing services. My first Six Sigma project ever was in reducing times in the emergency room. So if you think about it, you just as a consumer, you go into emergency room, how long does it take for you to walk into the door and actually get service? So that's another way where they're going to, lean it out. So the neat thing about it is healthcare is it's a big term. There's a lot of different areas that you could choose to see how this framework would apply. Okay. Okay, so then address the following for each framework. So there's 3 frameworks. Address the following for each framework. Give an example of a type of healthcare quality issue that can be improved with the quality improvement process. What are the desired outcomes? And I actually just covered a couple. Based on the framework, what would you measure for change and improvement? So based on the framework, what would you measure to change, and actually I already gave an example, for change or improvement, right? So what are you looking to make better? What is not working as best as you'd like? What key organizational staff is important to accomplish the improved framework? Like I mentioned earlier, the framework doesn't work itself. Okay, you need people and you need data. So with each framework, you need to identify who those key people are. And the last bullet, based on the example given, what is a way that an organization can manage the quality improvement change? Okay, how can a company effectively do this time and time again? The number 3, submit your assignment by following the instructions below before the deadline. Okay, so citation requirements, minimum of 2. So you have to have a minimum of 2. And then it says word count, 5 to 750. So, and I posted this, what I'm about to say, I also posted this in the announcement section. The word count's a guide. It's a recommendation. It's to get you about how long your paper should be. Most of the papers at this level for, weekly assignments are, 500 to 1,000 words, it equates to 10 pages or 7 pages or something like that. What I'm going to look for is how well and how thoroughly you addressed those 1, 2, and 3 points. Okay. So if you have to go, slightly over 750, fine. If, you're sharp as a pencil and you can get all that, very thorough and well articulated and cover all that in 500 words, then good for you. I mean that sincerely, good for you. That's some very crisp writing. My point is, the key thing is when I read your paper, I'm looking for how well you wrote about the requirements. So, because I've read papers where it seems like they got to that, just over that minimum threshold and pretty much just seemed like they just stopped writing. So, again, the word count is a guide. It's not an absolute. All right. APA formatting, it's going to be very important. Now, I posted in the announcement section about APA formatting. Your title page, very specific. I have specific requirements. Your paper, you're going to need to use level 1, maybe level 2 headings even. Make sure you have your references. Take a minute, if you haven't already, and make sure you look at the video. I posted in the announcements about APA formatting. I'm very particular about it. The reason I'm particular about it is because the APA formatting, for one, it's required. For two, when using APA formatting appropriately, it also works as, you can use it as an outline guide for you. It helps you in your writing because you can put in your titles and what you need to write about. Maybe you even want to skip around. Maybe you start with number 3 or go back to 1. That's up to you. Also, APA is in third person. So unless it's specifically, your assignment specifically requests or requires a reflection paper, or reflection paper is typically always from the I statement. I felt this way. I saw that. That's reflecting. I. APA is third person. And third person puts a focus. A reflection is a focus on me. I. Standard APA is third person, that puts a focus on the thing you are writing about. Okay, it's you're talking about the thing, the issue. In business, you write in third person majority of the time because you're writing about the subject, you're writing about the work issue. That's what the focus is on. And so APA formatting helps. So I'm very particular about it. If you haven't watched the video and looked at my sample paper, please do so. And I used to teach APA for a few years actually, so I know the manual pretty well. And in my video, I break it down to really just the key things students need at this level, even through, for graduate, undergraduate, and graduate level. It's all you need out of that big book, which is really cool. You only need a handful of things to really master to write a beautifully formatted paper. If you have any questions about any of this, including APA, please reach out to me. All right. Well, I think that about does it. Of course, you submit it and everything. Do you want to take just a minute to take a look at the rubric or the syllabus? Because remember, the syllabus here is the same, the assignment rubric, right? So this, as you know, is how I'm going to grade your paper, because we got to stick to the rubric. So content frameworks, let's look over here at exemplary. Comprehensively summarizes each framework, including the key steps, data used, and purpose. So when and y'all want to be shooting for 100%, right? That's a goal. You're not going to write a paper saying, I'm going to shoot for 50%. We're shooting for 100%, right? So remember what I said about the word count. That's a guide. What I'm looking for is if you do it thoroughly. The grading rubric says comprehensively, okay? Content, so these are content sections, right? These first 3. So frameworks and then challenges. Again, comprehensively discusses challenges of implementing the framework, all right? Number 3 here. how it's used in healthcare. Comprehensively discuss how each framework is used in healthcare. Remember, healthcare is a broad area, okay? So those are the content sections. So, and then after that is sources and evidence. So demonstrate consistent use of credible, relevant sources to support ideas that are situated within the discipline of the genre you're writing, okay? And then control and syntax, mechanics, and APA formatting. Uses straightforward language and generally conveys meaning to readers, minimal errors in grammar, spelling, and other aspects of writing and reference. And then lastly here, applies APA formatting and includes reference list of works cited with a few minimal errors. Again, watch my video. You shouldn't have any issues on APA formatting, okay? So if you think about like what we just went through, when we go through when we look at these three, when we look through this information, right? So in reading those requirements and to-dos, you're going to take that, right? And then you'll synthesize it, and ultimately in your paper, you'll have you'll have your title page. You're going to have your paper title. And you're going to have your introductory paragraph. Remember, on introductory paragraph, you don't write the word introduction. It's your paper title, your introductory paragraph. Your introductory paragraph is always about what your entire paper is going to cover. And when I say paragraph, 3 to 5 sentences, that's a paragraph, not 2 sentences or not 20. It's 3 to 5. And then you're going to jump right into your first section. And your first section is right here. It's frameworks. So your first level 1 header is going to say frameworks, and then you're going to discuss it. Now, up under that level 1 header that says frameworks, you may need to use a couple, maybe 2, 3 level 2 headers when you talk about frameworks, right? Because you're going to talk about, there's 3 frameworks that they discuss: Six Sigma, DMAIC, Lean, PDSA. So frameworks, and then you can write about it. And then challenges. So your next level 1 header is going to say challenges, and then you're going to write about it. Then your third and final level 1 header is going to say how it's used in healthcare, and then you write about it. When you get through with that, that'll lead right into your conclusion. Now, the conclusion is basically the opposite of your, the opposite focus of your introduction, right? Because your introduction tells the reader, this is what you're going to read about. And then you write it. And then your conclusion says, hey, this is just what you just read. So I'm going to introduce you to it. You're going to read it. And I'm going to tell you what you just read about. That's the purpose. And then your paper will have your references on a new page. And you may need, for this type of assignment, to put in some graphs and charts, which you can put into an appendix, which is always pretty easy. When you're writing, just say appendix, see appendix 1 and put it in your appendix section versus trying to get an image that you'll probably copy out the internet to fit into your paper and everything fit together right with spacing. So I always like to say, see appendix, see appendix 1, blah, 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 and you can how to properly format that. So with any assignment you write, always look at the assignment requirements and always look at the rubric, the syllabus, because it has a rubric with the grading criteria, so it's important that you look at both. All right, well, that actually you can click the syllabus right here too. So that covers everything that I wanted to cover in walking through this with you. If you have any questions, please feel free to reach out to me. The email is always good because email I just get right on my phone. That's easy to do. And I wish you much success on completing this assignment.